Okay, we have a posterior view of the knees here. I'm going to remove the gastroc and point out a couple muscles here. The popliteus muscle, which clinically can wreak havoc on people. Show you why in a second. Okay, the muscle does have its origin on the lateral condyle of the femur, and its insertion wraps around here, has its insertion on the posterior surface of the tibia, so posterior proximal tibia. It's going to help with some flexion at the knee and internal rotation. Okay, this muscle tends to get really tight with being active, running, soccer, basketball, all that kind of stuff. And because it does have, there are some fibers, now this doesn't show it, but there are some fibers that do connect with the lateral meniscus that's inside the knee. So when this muscle gets tight enough, you can actually start to get some fraying and tearing on that outside border of the meniscus. And once this muscle locks up, the whole knee starts to change its biomechanics, which is hard on the hamstrings, the gastroc, and a whole host of other muscles and structures to the knee. Tiny muscle, very commonly omitted during an exam and evaluation, but once you fix that and reset it, it is remarkable the improvement that people have. Okay, the next one, very interesting muscle, the plantaris. Let's get a posterior view here. Okay, it does cross two joints. So we have the knee joint and the ankle that it crosses. Its origin is on the lateral condyle of the femur, and its insertion is down here on the calcaneal bone. Its action is flexion at the knee and plantar flexion at the foot. Another muscle that's commonly overlooked with some sort of knee or supposed gastroc or calf injury.